Hello, everybody. Welcome back to another episode. So today I have Amy Green, and Amy Green is a uh, registered nurse who works at the emergency department for over 11 years. She's also a certified death doula and an end-of-life educator and advocate. She runs Graceful Goodbye. Okay, she helps people focus on the sandwich generation, navigating end-of-life planning, the dying process, caregiving, grief, and death preparation. Her work aims to reduce fear and anxiety around death through education, advocacy for patients, and resources like her Good Death Roadmap Collective, which includes trainings, webinars, a community, and courses as well. Welcome, Amy. Thank you.
Thank you. Thank you for having me. I really do appreciate it. So thank you.
Yep, absolutely. Again, our mission, we're focused on the affordability problem in healthcare and gathering professionals, patient stories, to get the awareness out there is our mission right now. So, and I like what you're doing. I came across it. One of your posts was very interesting. Had to share it, and here we are talking now face to face. So I appreciate it.
Thank
So,
you.
so let's dive right in. Always start off with just, if you can, just share a little bit about yourself, where you're from, how you got into this space.
Sure. Yeah. I mean, you covered a lot, but I'm from Massachusetts, born and raised. I'm still up here. I don't know why I'm still here because it's so cold, but I've been a nurse for over 11 years. I did originally for a few years start in a general inpatient cardiac unit before moving to the ER. I realized, I guess, like early on, my whole like end of life education became my mission when, we would have patients that were dying or close to dying, and doctors would kind of not false lead their families, but in a way they would, and say, oh, we could do a feeding tube or we can try more IV antibiotics and stuff like that. And the patient would just get like shuffled back and forth to test and procedure. And it was just like the doctors almost were afraid to tell the families like it was that this stuff really isn't going to save their life. And then about 6.5 years ago, 7 years in July, my mom died. She had stage 4 colon cancer. And I was obviously her daughter, but I feel like I was part hospice nurse at the time too. But before she died, I promised her that as her healthcare proxy, I would honor her wishes no matter what. And when my both of my older sisters wanted to take her to the hospital, call an ambulance because she was, dying, she was unresponsive, I, came to the point where I had to stand up and say that I have the legal authority and we're not taking her to the hospital because I promised not to do that. And she was able to die in her bed like she wanted to. And that kind of, further, I guess, inspired me to educate people that how important it is to follow their loved ones' wishes. And then, as an ER nurse, I see it all the time, unfortunately. I'm sure what you saw with the post of mine that you found is so many families don't know that their loved ones are dying or don't know what end of life looks like and what's natural. And they panic and they send them to the emergency room. And it's just this horrible, uncomfortable situation for these patients that really wanted to just be comfortable and be at peace at end of life. And instead they're going through the ringer, the $1 million workups, as you know, all the things that we can bill for, right? And it's not fair. So I want to educate those people so that their loved ones can actually be peaceful and have a good death. And so here I am.
Wonderful. No, absolutely. And obviously on my page there's a ton of problems. And actually to back up a little bit, so my family too is part of the reason I'm doing what I'm doing because my aunt passed of cancer. My mother had a heart attack. She's still alive. But understanding this industry, knowing how expensive it is, how it can hurt people, and then also the decaying parts of it, where now quality of care is done, and as you're mentioning, you're seeing problems on the end side. We need more people like you that will stick up for and try to solve problems or ease some of these issues. So let's get into it. So you've mentioned focusing on the sandwich generation. Can you talk a little bit about that?
Yeah, sure. So I found a lot, I mean, and I will help everybody, right? No matter what age. But what I've witnessed in, real life in the ER It's with the adult children, and this is where the issue is. It's usually the person that's at end of life or the older person. They have all their stuff laid out. They have their forms filled out, their wishes, documented what they want, but it's their adult children that don't know, or either they, go against their wishes, which I don't think anybody does it maliciously, but it's more probably fear, panic, but also the fact that they don't know that, okay, this is end of life. They're not eating because they're dying. They're sleeping all the time because they're dying. They're not talking back to me because they're dying. And I found especially a lot of doctors, it's not to disrespect doctors because I feel like I work with the best doctors, but they don't tell people that about dying. They're just trying to save people's lives. So it's just they don't know, like millennials, Gen X, like this is a time where they really need to talk about it with their aging parents, aunts, uncles, grandparents, even because this sandwich generation is the one that's going to be involved. They're going to be the ones that are making those decisions when their loved ones can't make those decisions anymore. So they need to honor their wishes and they need to know what normal death looks like. And if you prepare for it, it's less scary. If you know what it looks like, if you know what it sounds like, if you know what the plan is, like with my mom, I knew she wanted to stay at home. So that was just, okay, I know what dying looks like. I know that she's actively dying. We're going to stay at home, it just makes everybody's life better. It makes, the caregivers, the families, the children's lives better, but it also the person that's actually dying, it makes their experience a lot better too.
And so as an ER nurse, is this something that I guess this is something that you do kind of on the side then, the death doula work?
Yeah. So I'm still full-time in the ER. My goal is not to be. I love ER nursing. I love it. I
Okay.
love it. But yeah, so this is, my business, which is more, I guess, part-time right now and full-time ER, but I do hope to flip-flop that.
No, I hope you do, and I definitely hope you do. I'm very entrepreneurial, so if you have a passion and you can put that work into a way that you can maintain your living standard, that's the dream right there. So I
Yeah.
do, and hopefully this channel can help. And we could talk after this too, because I have some marketing stuff that I can do for you too.
Thank you.
Yeah, absolutely. So, for the listeners unfamiliar with the term a death doula, how is that different from hospice care or like a grief counselor?
So let me start, I guess we'll talking about like the hospice aspect because it's easier and quicker to describe. So hospice, similar to palliative care, but palliative care, you don't have to stop treatment. But with hospice, general definition, which I feel like a lot of people don't know, you can have hospice for 6 months, sometimes even more. So to qualify for hospice, you need a terminal diagnosis with a life expectancy of 6 months. Doesn't mean you have to die within 6 months, but a lot of people don't realize that you can get hospice 6 months out or more, and the average person is actually on hospice for less than 2 weeks, which is very, very sad to me. My mom actually, hindsight, my mom, we had it for less than 24 hours. And so we didn't really have, that's why I was kind of her hospice nurse. But with hospice, there's a doctor that oversees everything. 9% of the care, or unless they're at a facility. But the hospice nurse maybe comes once or twice a week for 30 minutes to an hour to kind of check on things and, teach you the medications. So even though it's available, you don't have somebody there like with you, holding your hand. A death doula is, think of it, it's like an independent contractor. So death doulas, they're non-medical. So even though I'm a nurse and a death doula, if I was, practicing as a death doula, I technically couldn't do medical things because it's a non-medical person, even though I know medical things. Um, but they can do anything and everything. So there are some death doulas that just help with end of life planning, like filling out advanced care documents. There are some that come in and do legacy projects with the family and the person that's at end of life. There are some that will, like sit vigil. They'll be there at the bedside with you. If your loved one, is dying, stay there all day, all night, be there for everything. And then, some are available for grief work afterwards or funeral planning. So it's really just this broad aspect, and it's every single piece of end of life. And you work with them one on one. It's not through insurance. So if, somebody says, "Hey, I need you. I'm scared. Can you be with me all day?" Then they can do that. Whereas, hospice, you're limited. It's like, no, we have 30 minutes and then I'm out the door kind of thing.
And can you share maybe some common misconceptions about the dying process that you wish more people understood before facing it with loved ones?
Yeah, for sure. I think, well, the biggest thing that I see is honestly the signs and the symptoms of dying. Because that's as an ER nurse, that's what I see the most. I see the normal stages of end of life and people calling 911 and bringing their loved one to the hospital. So, I mean, every disease process, everybody's different, but usually like the last few months of someone's life, they start to get a little more tired. They may rest more, take naps more, their appetite decreases. And then the closer you get to dying, usually they'll stop eating and even drinking. So not everybody does, but a lot of people do. So, maybe a week or two out, or just even a few days before they're ready to die. And one thing that I see is that people force their loved one to the hospital because they're like, oh, they haven't eaten in 3 days and they need IV fluids and they need artificial nutrition. But what people don't know is that that is actually detrimental to a dying body when you put in nutrition and IV fluids. It actually does more harm than good. It can cause a lot of pain to that person, a lot of discomfort. It can cause them like nausea, just lots of problems that it can cause them because the body can't handle it. If you think about, like babies know how to be born, right? Like they just know at the time and all the things happen and the baby comes out. Dying is the same way. Our bodies know how to die. So our body naturally stops eating and drinking because it doesn't need that anymore. And when it's doing that, the certain organs, your body's focusing on the major organs like your heart, your brain, your lungs. It's not your intestines aren't going to work anymore. They're not going to digest food anymore. Your kidneys are not going to process fluids anymore. So when we force stuff upon people like that, it's so harmful. And then the other thing is that it's natural for people to just sleep and, look unresponsive. And a lot of loved ones will bring them to the emergency room too because they're like, oh, they're not responding to me. They're not waking up. They're unconscious. That's normal. And that usually means that they're comfortable and that the dying process is a lot closer. So it's like, let them sleep in peace. Don't shove them in an ambulance and do a whole stroke workup because they're unresponsive. So those are the biggest ones, I think.
Okay, and I can see where this education would come in very handy. I mean, if someone does send their family member to the ER during this natural process, they get loaded up with expensive bills, so you could ultimately save people a decent amount of money by having them understand this.
Yeah, for
Yeah.
sure. I've seen it so many times, it's like once they're in the hospital for a certain like complaint or something, I've seen so many end of life patients go through stroke workups, which are a bazillion dollars, or septic workups, or both
Mhm.
stroke and sepsis. And it's like they're dying. They're not septic, they're not having a stroke. And even if they were having a stroke, are we going to do anything anyway? We're not. I mean, patients that are 99, 100 years old being put through this stuff. And yeah, I mean, I can't even imagine what the bill is,
Yeah.
tens of thousands of dollars.
Absolutely. And then I guess if nothing is wrong too, and it's a natural part of the process, you can even have yourself fighting with insurance because, it's not necessarily medically necessary. I don't even know how that would work.
Yeah.
But I can see how that would cause issues. So can you walk us through the typical support that you would work with somebody with? Of course, you know, life reviews, letters, practical planning. Can you maybe talk about, or do you have like a system that you work through with your clients?
So it's really just it's more so, I guess, guidance on their situation and what they need. So with my Good Death Roadmap Collective, it's, mainly I have a community, right? So we have a bunch of community members, and there are a ton of resources on there. I have everything broken down for where somebody needs it, whether it's during the end of life stage or planning for the end of life stage or caregiving, or grief stuff. And it's all there. And then we do monthly live calls. So those are group calls. But then I'll also do one-on-one with people. So those are more individual with, somebody might be in a spot where they're starting to talk to their parents about this, or their parent is at end of life or getting close. But I do have people that are, in it for themselves, that are older, that need the help for themselves. So it's on an individual kind of basis. But I do also within my collective, I have my course, which I did. It's an online course, which I know that you've heard about this. It's called Transforming Goodbyes. It's basically it's end of life from A to Z. It's the very basics of, okay, what does end of life mean? Hospice, palliative care, death doulas, to advanced care planning, to then actually go into describing and showing what normal dying looks like. And then post death. So what to do after somebody dies right away, what to do, weeks to months after they die, and then, how to process grief and even navigating caregiving, from teaching people if their loved one's at home and they don't know how to change the sheets when their loved one can't move, to, change the bedding and give them a bed bath or something. So it really kind of encompasses everything. But I'll guide, depending on where somebody is in their journey, I'll guide them to the appropriate resource.
Now, many families avoid the talk about death. What's your best advice for starting those conversations without it feeling awkward or morbid or, especially when you're talking with parents or even kids?
Yeah. So again, I tell people, I guess it depends on your situation. So there are some people that are open to it. Some people, our age, that are fine, that want to talk about it with their parents, and their parents might be open. And you can just say something, like, hey, have you, made your will yet? Or have you done your advanced care documents, or, it can be a simple situation. A simple question like, you're having coffee and it's like, have you ever thought about if you were in an emergency and you couldn't talk, what you would want? Just asking what they would want. And then I have people that say, my father is not open to talking about this at all. How do I approach that? And then I'll tell them, okay, put it more on you, you know, even if it's you're kind of fibbing a little bit, you could say, hey, I realize, like, even though I'm only whatever 45 years old, it's really important to fill out my will, or my life, whatever. I could get in a car accident tomorrow, so it's really important. So I started filling all that stuff out. Have you filled that out yet? um, or even give examples. I tell people, I'm like, go on my Instagram or my TikTok, use one of my stories, say, hey, the other day I was watching this video and this nurse said, this horrible story about a patient that XYZ. Have you ever thought about this? So, I know that's what I kind of tell people.
Easy. No, that's good. And how has working in end of life care changed the way you live your own life day to day? Any mindset shifts or priorities that have changed for you?
I think a little bit. Certainly with my dad, personally, I've talked more with my dad about things. And then it's kind of funny. So in one aspect, it's helped me embrace it more, and it's people say live your life to the fullest. You never know what can happen. But then also sometimes I get that I talk about it so much that I get paranoid.
Yeah.
And then I'm like, oh my gosh, well, I'm not ready yet. What do I do? So it's just, I don't know. It's kind of like a double-edged sword, but it just, and I guess I see it's more so in my face just being at the ER when I see young people and unexpected situations happen, major traumas or overdoses with somebody who's only 20 years old and stuff like that. It really makes you reflect a lot.
Well, let me tell you, doing what I'm doing here, I understand the paranoia because even I'm getting, you just get in your head a little bit about it, or you're thinking so much about it when typically it's not in your head. At least it wasn't for me. Like, I handled insurance on a day to day. We're talking, not really dealing with the hardships of this industry. So I can understand where you come from on that aspect. Now, are you aware of what's going on in Canada with the euthanizing of their people and their MAID program?
Okay, well, yes and no. I
I was just gonna ask, what do you think about that? Because there's different opinions on it. I'd love to hear what you think.
Yes. All right. Well, first of all, I don't watch the news. I stopped years ago because
Me
I
too.
can't. So, but I have seen just little things, so I can't. What's going on right now, I feel like I can't give a full answer to because I haven't done the research, if that makes sense. However, first of all, I am a major proponent for medical aid in dying. I'm actually part of an action council in Massachusetts because we have it in legislation right now, and it's been in legislation for years and years and years, and it's like timed out, expired, and right now it's made it the farthest that it has ever gone before in our government. So I am definitely for medical aid in dying. I did see the other day some big social media person say that they're euthanizing people in Canada and they're allowing everybody to just do it and doctors are killing people and stuff like that. I don't know the research of what's happening right now, but what
Sure.
I do know is that I know a lot about medical aid and dying. I actually cover that in my course. And I do have some Canadians in my program in my membership, and they have family members that have gone through it in Canada. Medical aid and dying usually, every country has its own rules, and we don't even have rules because it's state by state here, but there are lots of protocols and procedures that are involved. So just for example, I'll give you a few like what's in Massachusetts on the bill right now is you have to have a terminal diagnosis that I believe I can't remember if ours, what we're doing, but anyway, from like 6 months to a year or less to live. And you have to have one doctor who says, yes, you absolutely have this terminal diagnosis. Then you have to get a second doctor who is totally independent of that doctor say, yes, you have a terminal diagnosis, you will die in X amount of months. A lot of places then you need a psychological evaluation to, see where your mind's at. Then some places like Massachusetts, you're going to have to write a letter to two separate doctors requesting it. It has to be like the certified letter with witnesses saying that you're requesting it. And then there has to be a certain amount of time that passes. I mean, you can see like there are even more rules, right, that go into it. Here it would be you have to physically be able of self-ingesting the medication. Canada does have IV medication or ingestible medication, so I do know that they have the two options. But here it's you have to be able to ingest it. So you couldn't hand me a glass or put it up to my mouth and have me swallow it. I have to physically take it and bring it to my lips and drink it. So I do know Canada, you can choose an option of an IV medication, which a doctor or a nurse practitioner would go to your house, but you're choosing all this and you have to have the diagnosis. I do know that in some countries, I feel like Switzerland, maybe I could be making that up, illness is allowed. Canada, people are saying right now, and I can't remember if Canada you can, but I know it was very, very, very limited in the world where anybody with like a mental illness could qualify for this. So again, I don't know the specifics, and I wish I had all
Mhm. Sure.
my notes, but even though I don't watch the news, I feel like it's getting blown out of proportion and it's not called euthanasia. It's not putting someone down. Like your euthanasia is essentially killing someone, right? Medical aid in dying is you are going to die and you most likely are going to have a miserable, painful, suffering death or just decline. Like ALS is a horrible, horrible, horrible disease. And if you had ALS and you could choose to just peacefully fall asleep, wouldn't you rather choose that instead of choking or not being able to breathe and being in pain and having your family watch you suffer? So That's where I think. I mean, I think it's a very good thing, and there are lots of protocols that are involved, and it's not just a doctor saying like, "Oh, I'm going to go put you down," you know?
I mean, I'm glad you cleared it up. I know for myself, just thinking about it just scares me, ultimately, is what it does for me. And I've also been seeing how the people in Canada, they're seeing increased use of MAID. So whether it's a good or a bad thing, I'm not sure, but I only consider it from a personal standpoint, going into my future, like having to take care of my mom. I know my mom, she's getting up there. She just sent us an email the other day about how she's going to handle the will. So I know she's front and center on thinking about it. And then on my dad's side too, it's something that I'm going to have to think about. So, but I know I would want to put their care into people's hands that I trust, that I know will care for them. That's ultimately my only concern about it. But to hear from somebody like you who's working with people in Canada would love, I always like the real world experience, the real world ideas from it that are from people that know what's going on or have a better idea about what's going on. Because I don't live in Canada, I've never been to Canada, I don't know what's going on. But it does
Yeah.
scare me. The whole idea does scare me. But
It
the
is,
idea
it
of,
is. Sorry, go ahead.
no, I was gonna say, but the idea of death is scary, all
Right.
around. So it's like almost there's no getting around it. Go
Right.
ahead.
It's again, I think, and I don't want to quote because again, I don't have my resources. I think Canada, it doesn't, you don't, maybe you don't need like that terminal, like that window, but it's like more so like maybe a really chronic condition too can qualify you. But the whole point is that no matter where it is, it's the person's choice. Nobody makes that for them. No, anywhere in the world, that person has to request it and go through the steps to get it for themselves. There's nowhere in the entire world that a doctor says, "Oh, you're dying. I'm going to euthanize you." So it has to be initiated by the person. It has to be, and they have to qualify. They might not, and multiple doctors would say, "No, you can't do this. You don't qualify for that." So, I mean, hopefully that puts your fears at ease a little bit. Yeah, maybe more people are using it there because it is available, but again, it's that person that's choosing it for their own life. It's not a doctor that's choosing it for them.
And then the other aspect, and this is why our channel is together, is obviously the affordability problem. So having to choose between MAID or going through the treatments necessary to maintain chronic condition or get you out of the chronic condition, weighing obviously what side would be a higher cost for the family. And if we can't figure out the affordability problem, this option of MAID is going to be far more attractive, maybe because most parents are selfless, right? They're going to say, I don't want to put you through something like that or have to go through, right? So maybe it's just better off we go this way. But we still have an opportunity to where we can make healthcare affordable again so that this isn't a part of the consideration.
Right.
And then with innovation, technology, specializations, all improving, supplies improving or increasing, we should see the deflationary effect in prices, so that is not a concern. So, and that's why we're doing what we're doing. We're working on those things. So, God willing, we could we'll get some of these things through. But let's move forward here. So let's talk about the end of the after parts, right? So grief doesn't end with death. How do you help people navigate the after period, or what's some advice that you can share with listeners supporting with somebody that may be going through a situation like this?
Yeah, sure. So one big thing that I really like to tell people is first, right when somebody dies, you don't have to rush to do anything. Just take a minute and just, or hours even, and just be present, be in the moment, sit with your loved one or something. You don't, I feel like especially here in the US, right? We are like, and I even did it with my mom. When she died and it was like 3 a.m. and we called the hospice nurse and we called the funeral home and they came out suit and ties at, 3:30 in the morning and they picked my mom up. But you don't have to do that. You can take a few hours, you can take 12 hours, you can do whatever, and you can be with your loved one. You can read, you can pray, you can tell stories, you can have other family members come over and say goodbye, stuff like that. And I feel like a lot of people don't realize that. They just, it's like check boxes. Okay, call the funeral home, plan the funeral, do this, do that, check, check, check. And we just rush through everything. Um, and then, moving on, and I have a lot of resources for people, what you can do within the first few hours, and then the first few days, and then the first few weeks. But moving on to grief, everybody experiences it different, right? And we've all heard the 5 stages of grief, but what I want people to realize, it's not a linear thing. It's not like you go through, like denial, anger, sadness, whatever. It doesn't move in a line. You can go back and forth through all of them. It's a mess, and it can be years and years. And then you can think that you're better or over it. And then you hear a song on the radio that reminds you of somebody who died 10 years ago. And then next thing you know, you're a mess. But it's okay. Whatever you're feeling, whether you're pissed off or whether you're tired or just depressed, it's all normal. And there are different ways in whatever stage you're in to cope with it. And I tell people, it never goes away. It doesn't ever go away,
Hmm.
but it does get easier to cope with and it does get different, if that makes sense. Like my mom, this summer will be 7 years. And obviously, I don't cry as much as I did in the beginning, but that doesn't mean, there just a couple weeks ago, somebody said something to my mom and I just lost it and I started crying. And it's, almost 7 years later. So it's always still there, but we learn to live with it as part of us instead of having it consume us.
Absolutely. And one of my biggest principles that I live by is embracing reality and dealing with it. So I think people struggle with their emotions or this grieving process because they want another reality or they wish they lived in another reality. And dealing with anything other than the real reality just always causes anxious and more emotions, strong emotions than necessary. And I know I experienced that too with my family too, because I mean I was upset. I never when I saw my mom after a heart attack and she had the tubes hanging out of her. Oh, and I was relatively young, so I was like 22, I think at the time. So I was like thinking, I'm like, oh my goodness, do I have to go? But luckily it didn't happen. But like she didn't pass away. But I couldn't. It's just, these are painful periods, painful parts, and we shouldn't be afraid of them being negative. I think it's best that we embrace them and just learn to deal with them, which is why somebody like you doing what you're doing is really profound. I actually didn't even know this was a thing until I came across your page. So like I'm learning for the first time really that I mean this is important. This is definitely important. And I might even need you hopefully in the years to come. Years to come.
Hopefully not for a long time.
Yeah. Hopefully a long time, but I mean this would be very very beneficial. So what is how do clients either work with you or how can they find your well let's start with this. What are the costs to work with you, would you say for any listeners? Or what's the typical cost for something?
So I mean, there are a couple of different levels, but I really honestly try to keep everything affordable. So because I I want everybody to do this, everybody to be prepared, right? It's because it's going to make everyone's life and death easier and more peaceful. But I've been told so many times by so many people that they're like, I can't believe you offer what you offer for that. So essentially, my collective, which gives you my entire course, my monthly calls, my individual call, all the support, the community is $400. And that's it. And then
That's
I
nothing.
do have I have a monthly membership, which is $22 a month, and it's the community and all the resources and the monthly calls, but it doesn't include a one-on-one or the my program, my course. So it's a little, easier, affordable for other people, but they don't get all of the resources. And then they could add on though, it'll be 97 to do a one-on-one call with me, which is still really, really low cost. But that's what I offer right now. When I can do more doula stuff, when I'm part-time in the ER, it'll be different. It'll be dependent on the situation and what's needed.
Now, I know you said when you're working with people, they're by the case, by consideration or of the client. Are your stuff like done for you, or you kind of do like a guidance for to help you, like done with you type of thing? Is it like a done for you or done with you, or do you offer both?
I mean, it's kind of. Both. I mean, I have all the resources and all of the support and trainings are already done. They're for you. Like they're already there. Everything that you need. But and some people are just like, okay, just point me in a direction and I'll be good.
Hmm.
Or they're the other people that would need
Want to
more
get it
hand
done.
holding. So
Yeah.
if they do, I'd say, okay, you're going to go over this, and yes, this is what we'll do, or this is.
Okay. So it's all
Um,
within that 400 pretty much?
yeah.
Okay. And that's a lifetime?
Mhm.
Wow. Guys, if you're listening to this, that's a wicked offer. Very good
I
offer.
know, honestly, people tell me all the time, like, you're kidding, right? And I'm like, no, I'm not.
Yeah,
But I want I want more people to access it. Like that's what it's about.
absolutely.
It's so needed and people don't realize it.
Absolutely. Absolutely. And hopefully in a couple of years, like I said, I didn't even know this was a thing until we started talking. So, and hopefully like I said, my family's good for the long term. So hopefully it's a couple of years before you get my call. But let's go ahead and close this out now. If you could give yourself, your younger self, one piece of advice about preparing for death, while still living, what would it be?
Wow, that's a good one. I guess for me, it would be to talk about it sooner. Even though I just turned 39 plus one this year. Um, I would I would still talk about it sooner and then talk about it with my kids sooner just to get it more comfortable with it. And then I would say for, loved ones like my mom, obviously I've lost grandparents and stuff like
Mhm.
that too, but it's kind of what I said a little while ago is just to take time and be present, like spend more time with my mom right after she died instead of checking the boxes of what do we do next.
Mhm.
But I think that's a really big thing. We just rush through everything.
Mhm. Yeah, I could see how that would happen. And you're in a frantic state, so you're kind of moving frantically. I can see that. I can see that for sure. Now, where can people find you once they get off? Where can people find you to connect with you, reach out to
Yeah.
you, questions?
On Instagram or TikTok, I have the same name. It's a graceful goodbye, but it's the letter A and then a dot, graceful goodbye. So it's that for both Instagram and TikTok.
Perfect. 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 Is there any other advice or anything else that you would like to get off for the people, any value before we end our time here today?
Just really like don't be afraid. If you think about all the things that we're afraid of and all the things, so we plan for everything, right? We plan for new babies, we plan for weddings, we plan for graduations, we plan for birthdays, holidays, but we don't plan for death. And death is literally the one thing that is absolutely certain it's going to happen. So just to start, and I did a video the other day. I thought I was pretty creative. I came up with this myself that, planning for death and end of life is like riding a bike. And if you think back to when you were a little kid and it was time to learn how to ride a bike, you were probably scared, right? Because you're like, what if I crash? What if I can't stop? What if it just tips over? And you start with the training wheels and you start with, mom or dad holding on to the seat with you. And then you start to feel a little more confident because you got on it and you're like, okay, I didn't fall off. And then they let go of the seat, right? And you drive around with your training wheels. And then you start to feel even more comfortable. And you're like, okay, I know how to use the brakes. I didn't crash. I didn't get hurt. And then you take the training wheels off. And then, a week or two later, you're flying around the neighborhood on your two wheels. And it's like that. Just start. You can start with the training wheels, but the more you do it, the more you talk about it, the less scary it's going to be because I'm telling you from personal experience, you do not want to be the family in the ER and your loved one is dying and the doctor's in your face and the alarms are going off or they have the tube down their throat and you have to make that decision and you don't know what they wanted. You don't know, did they want CPR? Did they want, to be intubated? Did they want to be comfortable? Or at what point do I make them comfortable
Mm.
while you're in that chaotic moment? You don't want to be like that.
And what a great point too to wrap this up because that's exactly what we're doing with the affordability problem. These systems of healthcare, massive. This machine, I keep talking about this machine of healthcare, absolutely massive. And there's just so many interconnected parts, and a lot of these parts too are decaying. But this general association that we have with this massive machine, I would say for at least being on my channel, like 80% of them, mostly negative. And if we got to understand these interconnected parts and truly, because like working with people, from what I've noticed, working with people like you, or the doctors, or the nurses, you all mean well. Everyone
Mhm.
here means well. I would say 90% of the people mean well. We do have maybe a small percentage of the bunch that don't mean well, but this general association of it being negative, I think once we look under the hood and we start discussing these things, because we should discuss these things, they just want to brush them off or delegate them to other people or have someone else figure them out for us. When we start doing it, things become clearer. They're not as scary. Actually, they're not scary at all. They're a natural part of the process. They're not natural part of life. And honestly, at the end, they're beautiful, beautiful parts of life. So what a great way to put that. I'd say that's just about it. Thanks again, Amy, for joining us.
Thank you.
I'm grateful to have connected with you, and I look forward to connecting here in the future. And if you ever need anything, reach out. Let me know if you want help with anything. Get on the channel again, or whatever you need. Let me know. I'll see how whatever I can do to help you out, bring you people, or get you out of your full-time job into your full-time passion. That's a dream of mine too. So, but yeah, thanks again. And then everybody who's listening, stick around. There's a affordability problem, I swear. When I touch on this proposal coming soon, I mean, what else do we have? What other options do we have other than everything getting more expensive, more expensive, more expensive year after year after year? What other options do we have? So, and soon I'll be releasing it more publicly. I'm going to go to the people that I think can make the change. If they say no, I'm blasting it everywhere. So let's hope they don't say no because we need some change. But thanks again, Amy.
Thank
Um,
you.
absolutely. And see you guys in the next video.